Hi, everyone. My name's Samantha Daruwala, and I'm a postdoctoral researcher with Dr. Bryan at The Ohio State University. And today I'll be presenting on my project called Examining Firearm Owners' Preferences for Peer-Delivered Lethal Means Counseling. So first, I just want to acknowledge that this project is funded by the New Jersey Gun Violence Research Center, and we really appreciate this opportunity to do this project. Thanks to them. So first, I want to start off with some background about why we're doing this project. So as you might have been hearing, firearms are considered the most lethal means for suicide and account for more than half of all suicides in the US. Multiple studies have shown that firearm ownership is associated with suicide death above and beyond several other factors, such as like demographics and prior suicidal thoughts and behaviors. And so the risk of firearm suicide doesn't only apply to the individual firearm owner, but to the entire household, with one study finding that the risk of suicide is 300% greater for all household members residing in a home with at least one firearm. Importantly, the risk of dying by suicide is increased when firearms are stored unsafely, which allows an individual in a crisis easier access to a highly lethal mean. And the risk of suicide can be decreased through the use of secure storage practices, like storing firearms unloaded and in a locked location. Lethal means counseling, which involves a discussion of limiting access to specific means for suicide, is a recommended best practice for suicide prevention. And a recent study found that lethal means counseling can be effective in promoting secure firearm storage practices among firearm owners. And so with lethal means counseling, it's typically delivered to those at risk for suicide in clinical settings like mental health clinics, emergency departments, and primary care settings. And so this approach may critically miss individuals who do not seek care or disclose their suicidal thoughts to providers. So for example, a recent study found that individuals who died by firearm suicide were less likely to seek treatment for mental health. Additionally, firearm owners tend to rate physicians and medical professionals as the least preferable messengers on safe firearm storage practices. And so given this, lethal means counseling needs to be provided outside of clinical settings as well. And a community-based approach like peer-delivered lethal means counseling may be an option. So currently there's limited research on peer-delivered lethal means counseling to firearm owners. And so it's necessary to understand the factors associated with firearm owners' preferences for receiving these conversations. Prior research suggests a source's perceived similarity by an audience can increase the credibility and likability of the source. Perceived similarity has also been shown to reduce resistance to the message itself. And so firearm owners may be more open to receiving legal means counseling when it's delivered by a peer who is more similar to themselves in terms of demographic and firearm-related characteristics. And so another thing to consider is that in the United States, throughout the country, there are differences in terms of firearm laws, the rates of firearm ownership, and adherence to gun culture. So for example, looking at New Jersey and Ohio, they differ quite a bit in their firearm laws and ownership rates. And research has shown that greater firearm availability and weaker firearm laws are associated with higher suicide rates. And so given this, preferences for peer-delivered lethal means counseling may differ based on the region. And so for this study, what we're looking at is we're examining if firearm owners' openness to receiving peer-delivered lethal means counseling differs based on characteristics of the peer. We're specifically interested in also looking at if it differs based on gender and state of residence as an exploratory aim. And the overall goal is to ultimately inform the development and implementation of peer-delivered lethal means counseling to promote secure firearm storage practices for suicide prevention. And so we hypothesize that firearm owners will report more openness to receiving the intervention when it's delivered by a peer who is more demographically similar to them in terms of gender, race, and sociopolitical beliefs. We also expect that firearm owners will report more openness to the intervention when it's delivered by a peer who's a firearm owner, reports the same primary reason for firearm ownership, and has similar years of experience with firearms. So now on to the methods. So for this study, we're going to be recruiting 100 participants who meet the inclusion criteria and pass the data quality checks. Given our exploratory aim, comparing states of residence and gender, we're recruiting 50 individuals from New Jersey and 50 from Ohio. And for each state, we'll recruit 25 men and 25 women. Participants will be eligible if they are at least 18 years of age, are able to understand the English language, identify as a man or a woman, and identify as firearm owners who are currently residing in New Jersey or Ohio. So first, people who are interested in this study will take a brief online screener to determine their eligibility. And if they're eligible, they'll be emailed a link to the full survey. Several data quality checks are going to be embedded throughout the survey, and I'll be talking about that a little bit more. And we'll be reviewing those responses within 1 week just to ensure that they met the data quality checks. Those who pass the checks will then be emailed a $25 gift card as compensation for their participation. For our measures, we're first going to be using a brief screener, and that's going to include some items on their demographics, including which state that they reside in and their gender. We'll also be asking individuals what strategies that they use for home security practices, and this will be using items that were previously developed by our research team. And responses to this item will be used to determine if an individual is a firearm owner. And then again, as I mentioned, within the screener, there are some quality assurance checks, including a CAPTCHA item and 3 embedded items in the survey as well. So if individuals are eligible for the study, they'll be then sent the full survey. So we'll be asking them some additional demographics, as well as their items assessing their firearm-related beliefs and experiences. This will include things like years of use, number of firearms that they own, and their primary reason for ownership and the storage practices they use. Openness to peer-delivered lethal means counseling will be assessed by asking participants to imagine that their peer approached them and said that they wanted to talk to them about using secure firearm storage practices as a way to prevent suicide. They'll use a scale from 0, meaning not at all, open, to 100, meaning extremely open, to rate their openness to the conversation overall and based on characteristics of the peer, such as their gender, race and ethnicity, sociopolitical beliefs, firearm ownership status, primary reason for ownership, and years of experience as a firearm owner. So due to growing concerns about careless, inattentive responders and bots, which we will be following several recommendations of data quality checks to ensure participants are providing valid responses and that they're not fraudulent. And so during the informed consent process for the screener and for the full study, we'll be outlining these data quality procedures. And after they provide consent, they'll be prompted with another reminder about the data quality checks. And so the specific procedures that we'll be using is that we're going to be having only one IP address and one email address per survey entry. We're also using CAPTCHA items and a hidden location field to confirm their location. And as I mentioned earlier, there's also several items in the surveys themselves just to ensure that people are paying attention and that they're providing valid responses. And so several strategies are going to be used for recruitment. First, we're going to be using researchmatch.org, which is a secure NIH-sponsored program that helps connect individuals interested in research studies with researchers. We're also using social media ads that were developed by OSU's Center for Clinical and Translational Science. And then we'll be able to target this specifically to men and women who are residing in New Jersey and Ohio. And finally, we'll be using referrals by other researchers who have previously recruited firearm owners. And so we're hoping, to get that data collected soon and be able to share it with you. So as I mentioned, data collection is ongoing, and we are really looking forward to sharing those findings with you once it's fully completed. And I thank you all for attending. If you have any questions, I'm happy to answer them now. Thank you, everyone. I hope you all, we can end a little bit early because it looks like no one has any questions, but I hope you all enjoy your rest of the day and have a good weekend.